So without further ado, I'll introduce my counterpart, Jean Tanner. Jean is a former mammography tech. She has spent 35 years in the mammography world. She has a wealth of experience, and she's going to take you guys through how the machine captures the images, a summary of all of the studies that have been published, and all the great benefits that come with 3D. So from Hologic to you, thank you for investing in a technology that we know is changing lives. Thank you.
This is a great opportunity to bring this new technology to your community. We know mammography, conventional mammography, is very challenging. Of 1,000 women screened, we know 100 will be called back. And of course, these are national averages. And then you can go all the way down the line until you see that one missed cancer. So we know that in 2D mammography, tissue can superimpose upon itself and hide pathology. Conversely, superimposed tissue can then look like pathology. And that's the number one reason for callbacks in the mammography world, is that we don't have conclusive diagnosis because something is being obscured within that mammogram. So the solution to this is tomosynthesis. We're actually able to evaluate the breast in 1 millimeter slices. And another way to talk, I talked about this on the van for those of you who talked to me, think of it as a deck of cards, or a book for that matter, as if you're looking down at it in 2D, you understand that there are things in the deck of cards, or the 1, the 2, the 3 that you can't see. But once you slide the whole deck out, you can see everything. It's very similar to that in tomosynthesis. So for Hologic, what we do is we move 15 degrees and we do 15 exposures across the breast. That never changes regardless of the breast size or the breast composition. 15 degrees and 15 exposures. It takes about 4 seconds, not long at all. We reconstruct those images into 1 millimeter slices. Now what will vary, of course, is the number of slices that come with the exam. So a 5 cm compressed breast will give you 50 slices. Okay? 15 degrees, 15 exposures, and then 1 millimeter slices. Now the system itself that you purchase, the dimensions, can be done in 2D. You could do 2D imaging all day long. You can do tomosynthesis the way I just described to you, the 15 degrees and 15 exposures. But what we do most often, and the way we see the best benefit for tomosynthesis and the greatest increase in sensitivity, is what's called combo mode. So under one compression, whether it's CC oblique or any degree of obliquity, the system will do 15-degree arc across the breast. It'll move back to 0 and then do a 2D exposure, all under one compression. The whole thing takes about 6 or 7 seconds, and you saw it over on the van. It's very fast. Nothing will change for the technologist. The positioning is the same. The exam is transparent to the patient as well. And you'll start to see the tube head will move down 7 degrees. Exposure initiates, 15 degrees, 15 exposures, back to 0, 2D exposures made, and she's done. That's it. Just that fast. And I won't go over the rest of it, but as I said before, you can do this in any mammography angle, classic or otherwise. We know that tomosynthesis is more effective or more sensitive than 2D alone. And Jason mentioned a number of the white papers that have been published. To this date, they've been well over 150. I'm going to go over 3 of the most recent ones here this evening. This could actually be found on the website, and the Hologic website as well, but it's a summary of all the studies that have been done, and we've categorized them. So for instance, if you want to read a study that speaks specifically, for instance, to recall rate, then you can simply look down the column, and it will give you an idea of what this does. But to get right into clinical studies, the Oslo study, this was done obviously overseas. What they were able to demonstrate in the Oslo study is a 27% increase in overall cancer detection. But I think the most important part of this statistic is of that 27%, 40% were invasive cancers, life-changing, bone-shaking cancer. So this is pretty dramatic evidence that happened overseas. And they also saw a significant recall reduction of between 20 and 40%. The reason that variance is so wide is because they read things differently than we do over here, overseas. They do always do double reads, and they have different ways of settling disputes among radiologists. It was published in the Lancet Oncology, and it showed an increase of cancer detection 53%. Okay, this is combo versus 2D alone. This is significant stuff. This is big. Dr. Stephen Rose, he did a study of, I believe, over almost 14,000, a little over 13,000 patients, a large body of patients, and he was able to demonstrate a 35% increase in cancer detection. Of that 35%, 53% were invasive cancers. Again, significant cancers, with a great significant drop in recall reduction. So positive predictive value will go up dramatically. So if there's a recall, chances are that's disease. It's not going to be a core biopsy, a negative core biopsy. This one I want Jason to talk about, because this is Jason's customer. And this is a great story. I'm going to put him on the spot, I'm sorry.
What we don't hear so much, but that is just incredibly compelling about the technology, is when you look at a full-service breast center like yourself that offers mammography, ultrasound, and MRI. MRI is a highly, highly sensitive modality for imaging the breast. In fact, the knock against MRI is traditionally that it picks up on too many things. Too many things light up, and it's hard to tell what's dangerous and what's not. This is a study that was published about a year and a half ago that tomosynthesis, 3D mammography, was the only modality that was able to find a lesion in a 56-year-old asymptomatic patient. So they saw something on the 3D. They brought her back for additional imaging to try to do a biopsy under ultrasound. They couldn't see it. They said, okay, well, we'll definitely see it under MRI. They sent her to MRI, nothing. So the only modality that caught this was 3D. And that is just unbelievable to us and to the medical community. This is, normally when you compare X-ray against MRI, you would think that MRI would win out, but MRI is never used for screening. So we're looking at something that can be used for screening and catch things that are missed in other modalities is really something.
So I'm going to go through some clinical images for those of you guys who were not able to see clinical images on the mobile van. As we look at the 2D mammogram over here, we see something very posterior, right where the yellow arrow is, very spiculated, kind of creepy looking, and that area resolves itself completely. That is a normal mammogram. So we've saved that woman the anxiety of a recall, saved the radiologist trying to decide what needs to be done next. It's one of those see you next year moments, and it's great because to reduce the anxiety level in a woman who's had to be called back for a mammogram, as we know, can be pretty dramatic. This is a case of tubulolobular adenocarcinoma, again, very posterior, very close to the pectoral muscle, and there's our cancer. So that was totally missed on the 2D. This is the same case, the area of interest that's been electronically magnified, 2D on the left-hand side, right there's your cancer. So I think that any radiologist would be hard-pressed to pull that kind of diagnosis out of a 2D. This is one of my favorites. This is an example of a recall and reduction, a reduction and recall, excuse me. And you can see at the very bottom of the left MLO what I so technically call a spitzel at the very bottom, right? What is that? We can see it. We know it's something, but it's hard to say. So they did additional views, okay? They looked. Could they really push it out? They couldn't press it out. They really didn't know what it was. They still couldn't tell what it was. So they put the lady into Tomo. Here we are in 2D, and as we isolate two different 3D slices, we can see that's just a little tortuous vessel. That's negative mammogram, and we sure don't want to be putting a needle in that, do we? So again, we saved this lady a biopsy, and this is a negative mammogram. So another great example of how tomosynthesis can help eliminate the negatives. This is an example of multifocal cancer here. 2D obviously on the left, and here's on the right, this is a magnified 2D. 2D again on the left, and the 3D slice on the right. We have cancer here, we have cancer here. This is multifocal, and this is again an isolated 1 millimeter slice. This is infiltrating lobular. What worried the radiologist about this particular case was the area down here. She has what we call a busy breast. She's got a lot of stuff going on, but she was actually recalled for this area of interest right down here. This is the same area that's been magnified again in 2D, and this is the 3D, 1 millimeter isolated slice. This is definitely infiltrating lobular carcinoma. This is an interesting case as well. So this lady was actually enrolled in one of our reader studies, or one of our FDA submittal studies, when we were gathering lots of information to bring to the FDA. So she was called back for the area of interest on the left. And if I blow this up a little bit, you can see, it might be hard to see from back there, but what this is some microcalcifications on the left. It could be argued she may have a few going through the right as well, but she was called back for this area of interest. They did a biopsy on this, and those microcalcifications were negative. But because she was enrolled in this study, we were able to image both breasts, and then on the right, what we saw was a little area here. So we put her in the Tomo, and we actually found an invasive ductal carcinoma in the other breast. This is, I think, the same one. Yeah, multifocal. We've been through this one already. And I think that's all I've got for you guys.